Please note, this video was recorded on December 10th, 2024, just less than a week after the shooting of Brian Thompson. The perspectives shared in this video are based on the information available at the time this event occurred. Please consider this context while watching. Thank you so much.
I'm Dr. Ara Dugmajian, CEO and founder of the Duke Spine Institute. I'm here to talk to you about an event that occurred last week in the nation's news when the United Healthcare CEO was shot in cold blood by a disgruntled individual, and the shell casings had the words deny, defend, and depose carved into them. There's a lot of allegations that this individual who did the shooting had back pain, chronic back pain, and that he was denied care by the insurance industry. He targeted United Healthcare, the largest insurer in the United States. United Healthcare also has the highest denial rate in the United States for denying medical treatments to patients that need them. It is not an old story that we don't know about. We all know about denials. Denials means that the insurance company is refusing to pay or cover a medical treatment or medical test. Denials can happen for things like MRI scans, X-rays, CAT scans, or treatments like spine surgery. It doesn't surprise me at all. The public is becoming more aware of the insurance industry denials for medical treatment that are causing Americans to have to claim bankruptcy. Bankruptcy, number one cause in the United States, has been for the last 20 years unpaid medical bills that are then put onto the patient by the hospital because their insurance company doesn't pay for it, or if they don't have insurance, the patient doesn't pay. In the end, patients should not be claiming bankruptcy for unpaid medical bills. Our system should prevent that. Namely, insurance companies should have to pay for medical care. Unfortunately, as the system stands today, an insurance company can just say, your care that you're getting by the doctor and hospital is not necessary, it's experimental, and we're not covering it. There is no way to challenge the insurance company except by suing them. Lawsuits are very expensive. Lawsuits are going to cost anywhere between $50,000 to hundreds of thousands, if not millions of dollars. So the average patient can't just sue an insurance company. They don't have the financial means. Lawyers generally won't take these cases to the insurance companies, which cost the law firm millions of dollars, unless of course they're being paid or they have a guaranteed win. So patients are really stuck in a rock and a hard place. Their politicians have basically sold out on them. The lawmakers are making laws that are favorable to the insurance companies, allowing the insurance companies to not pay for medical care. The insurance companies get to keep the money when they don't pay for medical care, and every dollar the insurance company denies and doesn't pay a hospital or doctor or therapist goes into their profit margin. So the laws allow the insurance companies to basically take your dollars that you pay every month in premiums, and Americans are paying every year 10 to 20% more every year in premiums to the insurance companies for health insurance. It's becoming basically unaffordable to have health insurance. What we're stuck then buying are cheap plans that have very poor benefits that let the insurance companies get out of paying for our care. This has to stop. In one word, this has to stop. I guess that's more than one word, but we need to take control as a people, a grassroots effort. We need to let our politicians know we are not going to tolerate insurance companies using lobbyists to control and write laws in our states and at the federal level to deny medically necessary treatments for us. We have to fight back, and no one is going to fight back for you. There is no government agency, there is no Superman that's going to come down and save you. You guys must do it yourselves. This video really is about letting you know that the insurance companies have a stranglehold on healthcare and that they're going to continue to tighten the noose every year with higher premiums, higher deductible plans, more and more denials. My father was a physician. When he was practicing in the 1980s, this was about 30, 40 years ago, he said that in denials at that time for treatment recommended by doctors was probably about 1 million denials a year across the entire United States. My estimate today is that we have about 5 to 10 million denials a day in the United States. So how do we go from a country with 1 million denials a year to 5 million denials a day in the United States? The answer is the laws allow the insurance companies to deny your treatment, deny paying hospitals, deny paying anybody without any answering to anyone. They don't have to answer to any government agency. They don't have to answer to any board. They can just answer to themselves. There's absolutely no accountability by the insurance industry to anyone for the money that they're not paying for your medical care that you need. And I think the shooting last week of the United Healthcare CEO is basically you're starting to see steam coming out from the American public. They don't know what else to do. They have no way to respond. So instead, they take the matters in their own hands, and it's vigilante justice on the streets. I do not condone what happened. I think it's horrific. I think the story really is that there's people out there suffering with medical conditions that are 100% curable, but those cures are being denied to patients because the insurance companies don't want people to get cures. They basically want you to have no treatment, to live with your symptoms and pain and suffer, and they don't want to pay for expensive treatments even though they work. Because if they work, that means more people are going to want those treatments, and the insurance company is going to have to spend more money or do more denials. Our country is not healthy anymore. We're ranked the lowest of the developed countries in the quality of healthcare. We used to be number one back in the 80s when the denial rates were low. Now the denial rates are high and we're the bottom of the developed countries. This is wrong. We have the technology. We can now cure back pain and neck pain. You just need people to have access to that care. But the insurance companies are blocking that access. They're part of the problem. There's other issues as well. I recognize that, but the insurance industry is the biggest part of the problem. Anyway, I wish you all well.